Hi everyone, myself Kuldeep Sahu, a second year MBBS student at JNM Medical College, RAIPUR, and I have started a new MBBS series, a Master Anatomy, a comprehensive guide. These Mastering Anatomy sessions will be a comprehensive guide to be scoring higher, visualize better, retain greater, and connect the basics with the clinicals. In this series, there are 5 different videos, and each videos contain different topics. So in this video, I'll be talking about how to study anatomy effectively and retain it longer. So without any further delay, let's start the video. The very first point and the most ignored point is सब कुछ नहीं पढ़ना है. When you enter into a medical college, you just have qualified your NEET examination, so it is a habit of every NEET aspirant that they want to learn everything. ये MBBS में नहीं करना है. You are just an undergraduate student. You have 2 more subjects to study, that is biochemistry and physiology. You are not a PG resident who has to study just one subject, that is anatomy. So don't try to mug up everything. Secondly, understand the basics. Whenever you start any new chapter, always start with the basic concepts and terminologies. For example, before starting the cross section of brainstem in neuroanatomy, first understand the basic anatomical and functional concept of nuclei, parts of brain, the decussation and lemniscus formation. It will make your complex topic much more easier to understand. Now coming to the third point, active learning. Engage yourself in active learning such as drawing a diagram or labeling any structure. In this second video of the series, I have talked about one app which is absolutely free in the Google Play Store. In that video, I have talked about that app known as Anki, how it is useful in active recalling. You can check that video, link in description. Point number 4, use visual aids. There are many applications present in Google Play Store and iOS, Apple Store. You can go and search for the 3D anatomy application. There you can find any of the app and download them. Or else what you can do is, there are certain websites in the Google, you can search it on, like CanHub and Biodigital Human. They also provide the free 3D visualization of anatomical structures in their website. You can go and check out in the CanHub and Biodigital Human as well. Next thing is, relate anatomy with the clinical scenarios to understand the practical significance. I will give you an example to explain it. कभी आपने बच्चा हाथ में लिया होगा तो कभी उसके सर पे अपना हाथ फेर के देखिएगा, and you will find a shallow depression over the head of the baby. This is called as anterior frontal. Now this is your job to go to the anatomy book and find how many types of frontal are there, what is the age at which these frontals fuse. This is how you can apply your anatomy with the real practical things. In second year, when you will visit the surgery postings, you will actually observe more things that is related to the anatomy, right? भाई रिकॉर्ड करने वाला था, लाइट गोल हो गई. ठीक है. Now the sixth point is again one of the most ignored point, that is called repetition. Always try to review your notes and study materials regularly as much as possible to reinforce your understanding and retention. See, actually it's like connecting the neurons. The more you revise, the more you can interconnect the neurons and the more better your concept will be. Now coming to the point number 7, that is practicing quizzes and question banks. Test yourself by giving quizzes, mock test, MCQs, assess your knowledge and identify the areas for improvement. You can also buy a review book of anatomy for chapter-wise question practice as well. This 8th point is the most interesting point ever in this video, that is group study. When you are in a dissection hall, 1 or 2 person is dissecting the cadaver and the rest of the group are discussing about the couples in their batchmates or the food stalls outside the college or the birthday planning of somebody's girlfriend. So instead of gossiping all the time, gossip for a little time, and by the rest of the time, you can divide the topics to the individuals and each one will read and teach the topic to the group. You can do this in your hostel or PG as well. This is the most effective technique that even my professors have told me to do a group study. So that is why I am also recommending this thing. Point number 9 is mind map and conceptual framework. Create a mind map and conceptual framework to organize and connect the anatomical information in a more logical way. For example, I am giving you name of some structures and you have to identify what is common in them. And the names are as follows: vas deferens, thoracic duct, spinal cord, femur, transverse colon, umbilical cord, and the sartorius. Now you have to tell what is common in them. Remember, all these 7 structures have approximate same length of 45 centimeter. Write all of them in a one place because this is the most frequently asked question in Viva. Now the 10th and the last point is seek help when needed. Don't hesitate to seek clarification from professors or PGs if you encounter any difficulties understanding certain concepts. But remember one thing, it is suggestive that do not interrupt your professors in between the lectures, do not ask your doubt in between the lectures. First, let the professor complete their lecture and then you can ask your doubt separately. These were the 10 points that I genuinely needed when I was in a first year, and now it's your turn to execute them. Share this video to your first friend that you met in your medical college and tell them to subscribe to this channel and turn on the notification so that you can actually get the update for the next video. Till then, keep learning. Kuldeep Sahu signing off.